first off, patient comes in, we identify the lesion, and that is in this oval of purple polka dots right here. And we have the patient verify that with a mirror. We've gone over all of the risks and benefits, alternative treatments, and now we've gotten her permission. We're going to go ahead and mount her up with the lidocaine. She's going to feel a poke and a burn like a bee sting. It's not pleasant, but it's short-lived, and it's highly effective. And here we go. 1, 2, 3. Oh.
After going through all that,
No.
Absolutely, I don't blame you.
Everyone wants to know, how do you know how far to go and how deep to go? And this is one of our first landmarks. How you doing? Good. And then we make our incision just about 1 to 2 millimeters right around the lesion and right around what we've curetted. Make little hashtags because we need to have orientation as to what's up, what's down, what's right, and what's left. These little hashtags help us orient if we need to come back for a second stage of Mohs. How you doing? Good. And we just remove that final piece with our iris scissors, keeping the orientation. So I'm holding on to her left hashtag that we put there. Okay. We transfer that onto a transfer card that keeps our orientation picture of the nose right there as it was on the patient. Yeah, let's do. Take that back. Next we use cautery, which is a little electric current to seal over the blood vessels. Just doing great. The rest will do with pressure, don't you, baby? Okay. So now the patient will get a bandage on there and go to the waiting room to wait. We come over here and start the processing of the tissue. This is our map. We have labeled A1 and A2. We're going to cut this tissue in half so that we have an A1 and an A2 specimen. So we make an incision there, connecting those two hashes that we put on the patient. Put a few relaxing cuts into the tissue just so that when it goes to my histotech, it will process the tissue and make glass slides. It lays down nicely for her and allows us to see 100% of that margin. Now the other thing that we need to do is we color code our pieces so we know what's right and what's left. So I need to know what's the right side of my A1 and what's the left side of my A2. So we color code. The half is blue and the other half is red so that I know that when I'm looking at it under the microscope. We then ink the tissue so that it corresponds to that map and to those maps' colors.
I think so. I hope we don't meet again.
I hope not, at least not here.
I know.
So once again, we've got the blue and the yellow on A2. We've got the red and the blue on A1. We then put this into a little container that we're going to take to the lab. We orient them in a certain way, with A1 always being in the top left corner, and then A2 after that. Now the tissue is ready to take to the lab. So the patient will go to the waiting room, and we'll take this to the lab. We set this here, and then my histotech's going to take the tissue, and she's going to process it in what's called a cryostat, which is right here.
I am putting the tissue with a certain orientation so that when she looks at it microscopically, she can see it as closely to how it was in the body. So I'm just trying to get everything as carefully lined up as I can. And then we will freeze it. Okay. We'll go ahead and start sectioning. And each section is roughly 2 cell layers thick. And I will take sections at different intervals throughout the tissue so that she can have a complete picture of those sections. And check the sections microscopically before I stain them to make certain that I have the complete skin edge. And then load them on the stainer and wait for them to process.
This is the map that we have from our patient with the squamous cell carcinoma in situ on the nose. We had section A1 and A2. The slide was made of this, and we've now got section A1 and A2, with this being going in order from most superficial to deepest on the patient. We're going to look at this under the microscope. This is the most important portion of the Mohs surgery, because examining the tissue and making sure that all of the cancer cells are gone is really the strength of the Mohs surgery, and so this is the most important portion. So right now I'm looking at section A1 under the microscope, and I know that because I'm seeing the blue half and the red half and knowing exactly where I'm at. Tissue here looks very healthy. Now I'm looking at section A2 under the microscope. I scan first the edges, and then I look at the base. I can see that the precancer portion is just kind of right here in this area under the microscope. I'm going to label that as an 8K. We'll treat that with a little liquid nitrogen or cryotherapy, but she is actually clear of her cancer the first time around, and about 50% of the time we do get that clear the first time around. But we don't want you to have any discomfort, so we're going to give you some more numbing medicine. So here we go. Poke. See, you didn't even feel that poke, did you? Awesome. You may feel that numbing medicine because it's going to go out a bit farther than what we numbed the first time. It, once again, shouldn't be as bad as that first time around. You're just doing great. Super. We're going to put that betadine on there. That's our sterile cleansing soap. Once again, that's to decrease your risk of any postoperative infections.
Okay.
We'll wipe this off again after we're done.
Not a problem.
First, we undermined that tissue to loosen that up so that we can get it to close without tension. And then we cauterize to seal over the blood vessels after making those incisions and loosening up that skin. And now we'll put some stitches in to close this up for her. Yeah, oh, so You'll have one layer of stitches under the skin, as you recall, and that layer of stitches will dissolve over time. They're the ones that do the real work.
Sure.
They're the ones that aren't seen, but they're the ones that really hold you together, okay?
Okay.
Then you'll have a layer of stitches on top of the skin, and those kind of just approximate that top layer of skin, and so they kind of do the final finessing for us, and those will come out in a week. We are going to use that cream on you, but we'll talk about that when you
Okay.
come back to get your stitches out, okay?
Oh, all right.
Okay. Okay.
More picture here. Can you see without your glasses, or do you need your glasses back?
Oh, I can see with that. Yeah.
Just got a little line of stitches that's right there across your nose that you should have, okay?
Alrighty.